Thank you so much.
It's great to be back home in North Dakota. You have no idea how great it is. I live in Washington, D.C. What I'd like to do today is, well, first of all, let me share with you that I wear a whisk. I think I'm a really good cook. I'm actually a physician, but I think I'm a really good cook. But I wear it for another reason. I stir things up. And so I'd like to stir things up a little bit today. Jonathan Swift in 1711 said, "Vision is the art of seeing things invisible." Vision is the art of seeing things invisible. I'd like to share with you my vision for what we have the opportunity to do in this country. Disruption is something that is occurring all throughout healthcare. We're seeing knowledge diffusion. We're seeing the way we work together differently. We're seeing the use of the internet with people walking into the waiting room and into our offices telling us what the protocols are that we should be using. We're seeing devices that are taking over and managing care for people. We've heard about some of those ideas this afternoon. We're seeing all sorts of major changes as a result of technology in healthcare. I would like to argue that the time has come for us to engage in knowledge creation, that healthcare has an incredible opportunity and that we must seize it. We must seize it. We must have a vision for where we want to go. In 1976, we created in this country the Aviation Safety Reporting System. It is a system that allows the pilots, the cabin crew, the maintenance staff, virtually anybody who's in and around an airplane to submit a report and says, there's this problem. Anybody. And the information goes into a database at the FAA. We analyze that information. They determine what the potential causes were for the creation of that particular problem. They find out if there's other problems that have been reported like that. They then call the airline and say, maybe you should consider X, Y, and Z. And if there's enough of information percolating up, they say, hey, wait a minute, there's a warning here. Tell all the airlines about this problem. Let's do something about it. And then they engage in process improvement. They change the way we fly as a result of having information in a central place. As a result, in this country, the odds of you being in an accident if you fly are 1 in 10 million. The odds of you dying in a plane crash are 1 in 20 million. I fly every week. I do not worry about plane crashes. I do not worry. I worry about what kind of food I'm going to eat on the airplane. I worry about all sorts of other things, but I don't worry about a plane crash. We have an opportunity in healthcare because for the first time, we are going from a system where we have lots of dead data. Dead data is stuff that you write down on a piece of paper and you put in a paper chart, and you close the chart and it's dead, you can't use it, to a system of live data, which is electronic data. We've gone from, in 2000, 17% of all physicians in this country using an electronic record to the end of next year, where it's projected that we'll have 85% of all physicians using electronic health records. All of a sudden, we will have digital data. We will have data that we can analyze. We'll have data that we can review. We'll have data that we can say, what is going on with those particular problems? So let me give you one example of a problem, and that is hospital-acquired infections. The death rate from hospital-acquired infections is 1 in 350. Okay? 1 in 20 million, 1 in 350. Would you rather fly from Hector Airport or be admitted to the local hospital? Does anybody want to volunteer to go to the hospital this afternoon and be admitted? 1 in 350. Still pretty good odds. Nope, no volunteers. So the issue, my friends, is that we're at that point in time where we need the will, we have the way, We need to have the vision to create a national patient safety reporting system. The time has come. We should demand it. Thank you very much.